Magic 89.9.
Today's best music, Magic 89.9, 614. Hey, it's your girl, Tina Ryan. Welcome to Healthline. I'm super excited, as you can tell, obviously, because we've already preempted, me and Jada, that I have officially have a co-host. Doc Ryland, welcome back.
Thank you and welcome. Thank you so much. I'm here with Magic 89.9 with Tina Ryan. Doc Ryland with you.
Hindi pa kasi siya ganun ka-busy because he's a tabloidist. And then how many shows online do you have?
Online, I have like 3 and 2 radio stations.
Jada, tatlo lang naman, diba? I mean, it's a privilege for us that you're here.
I'll pull it back. It's my privilege for being here.
Thank you for making time.
I think this is the Mutual Admiration Society coming up to you.
But we're live on playback.tv/magic899, wherever you are, if you're at home. Who else listens to radio at home? Do you know anybody? I had to buy a transistor radio pa. Oh. But yeah, a lot of people are online. But also, I know you came from EDSA, and it's a sad situation.
There are a lot on the road right now. Just stay it cool. Listen to us. Listen to Magic 89.9.
I think
keep your cool.
I'm in good hands, you guys. But I can just walk out of the booth and Doc Ryland can handle the show. Again, welcome to Healthline. If you have any medical concerns, we have a doctor in the house. And of course, his specialty is
orthopedic surgery.
There you go.
I do carpentry 101.
That's my dream, to be a carpenter. Nobody believes me kaya. I really wanted to go to TESDA and learn carpentry. But anyway, Doc. So ako unang may question kay Doc. Masama ba talaga mag-crack ng knuckles?
Yes.
What? Are you serious, Doc? Yes. Oh no.
Wait, let me rephrase that. Masamang mag-crack ng muscles. Ng joints, ng knuckles.
Like this.
Yeah.
Sorry.
If it does happen sporadically, okay lang yan. But for you to forcibly crack it, let's put it this way.
It's become a habit for a lot of people.
I know.
So what's the effect in the long run?
So here's the thing. If we do have an inflamed joint for one reason or another, I mean, you work a lot, you do all of these things, and pressures build up in the joint. And it has to be released. So at one point in time, when you do something, it cracks. You hold on to something, you hear a crack.
Yung heart ko na-crack to.
Ibang crack yan. Mahirap gumatin yan. But if you do it forcibly and repetitively, remember you're moving the joint from where it's supposed to be at. So the likelihood of you having earlier degenerative osteoarthritis increases.
Look at my facial expression, Jada. I'm just looking at Doc.
Right?
So that includes not just knuckles, but you know how people do this, yung mga ganun
any
sa
joint
side?
for that matter. Any joint for that matter. Even the neck, diba? They go.
Ayan si Ace. Doc, sa stretching na crack, okay lang ba?
Sa stretching na crack, if you do hear that sound, especially without pain, okay lang because it's just the pressure in the joint that's released. What we don't want is for you to forcibly do that and to repetitively do that.
Okay.
Because what happens is, every single time, try to take note. If it cracks, it doesn't happen again.
Okay.
I mean, even if you do it forcibly, it doesn't happen again.
Okay.
Because for it to sound up, it does need pressure to be released. So if you do it repetitively,
I love that we have a doctor in the house.
The likelihood that it would be destroyed earlier increases, which means if you're like 30 years old, your joints might be looking like 60 by the time you reach 40.
Oh my gosh. So my joints now are probably like 105 years old. Everybody on playback, thank you so much. Hi, Enrix and Firebird and Christian. Firebird, Doc, masama ba ang chiropractor thingy? Okay, it's called, let's correct Firebird. It's the chiropractor is a doctor of chiropractic. It's chiropractic. Okay,
it's
Firebird?
chiropractic medicine.
Chiropractic medicine.
Yeah, that's a...
And that's the first thing I asked Doc Ryland when we actually met. Because Firebird, I was married to a chiropractor and I love chiropractic. If you're gonna, if
so
people
really
out there...
good functioning joints.
Yes, but I'm saying if you're about to bash chiropractors, don't because
we're not gonna bash
And he
anyone.
actually, Doc Ryland actually is a good, has a good friend who is also a friend of mine. Yeah, Doc Rob. Yeah, so if you have any questions regarding chiropractic,
well, not me. I'm not chiropractor.
Yeah, we're not experts, but we'll.
But okay, let's just put it this way: it's a specific science that involves manipulation of joints and muscles to actually release tension that we were just talking about, and relax muscles as they do that.
Basically, they deal with subluxations, and so Google it, Firebird. I mean, it's helped me. I miss it. I wish I was crapping money out of my butt so I can have a chiropractic adjustment every month. Because just like brushing your teeth, you need it. It's not a one-time thing, di ba, Doc?
Yes, it's not a one-time thing.
So anyway, welcome to the show.
Thank you.
Healthline. Next hour, please don't go anywhere because we are going to talk about biohacking, and I'm very excited about that because I know nothing about it. So we're going to get back to more of the music. If you want to call us, 863-10-899, or we have a Viber line. Doc, give it away.
Well, hold on. After that, of course, you can call us up at 86310899 or 0945-971-4011.
Jada, pasok na pasok, no? Pwede na. Pwede. This is Healthline on today's best music.
Today.
Magic 89.9.
Well, that's us. And yoo-hoo! That's the first time I think Doc Ryland is hearing the plug. So, yeah. I have a good-looking... what else can I say, Doc? We want to say hi to Pong. Hi, Pong. And I think Kian's tuned in. Pong is the junior, the mom of our junior jock, Kian. Also to Kingski, Doc. Ito si Kingski, sabi niya, nasa na? Paano po kung kapag nakaupo din sabay, then tayo sabay lagatok ang joint sa hita? Hi, tumatanda na talaga tayo. Ano yun, Doc?
Palagi ko sinasabi, kalabaw lang ang tumatanda.
Snacks.
Yeah. There are a lot of things that could actually cause it. But more often than not, if we do experience it, as long as there's no pain with it, we just observe for it. It does happen. Like I mentioned a while ago, pressures being released from the joint, or sometimes laxities of the muscle might end up with a sound from bone-to-bone contact, but you won't have pain simply because you still have that cartilage over that joint.
Oh, so the minute the cartilage
is gone.
And wait, okay, let's talk about the cartilage, Doc.
Okay.
What are the causes of the cartilage? Ba't nawawala?
Well, more often than not, it's wear and tear.
Aging also?
Not necessarily aging, but it's actually how you use your body for the past several years. Remember, we start walking at 1 year old.
Yeah.
So how have you used your body since you were 1 year old?
Okay.
1 year old.
And kato, meron akong naisip na, ano ba yung injury na matagal nagkihit? ACL ba yun? Mostly ACL. Sa basketball. Ano yung...
The ACL is
is that a cartilage?
Cruciate ligament.
Oh, ligament.
It's a ligament. It's actually right smack in the middle of the joint of the knee, and it actually, holds the entire leg and foot, and at the same time gives us notion where the leg and foot are, if it's up or down or sideways. So that's what the ACL is all about, and it's supposed to keep the joint intact and stable. So if it's cut for one reason or another, or injured or torn, then you have a very unstable joint, and that's going to be a problem if you do especially have very seriously active things to do for that joint.
Okay. So what's the busiest? What's the busiest joint in our body?
Not the busiest, but we usually would often talk about the knee simply because one, it's one of the joints that holds our body, and the thing is, our joints are similar anywhere, everywhere. It just so happens that the knee is the largest joint. So when you talk about it, you can easily visualize things, but it can happen anywhere to your fingers, your shoulder, your elbow, etc., etc., etc.
Got it. Okay, you can call us at 863-10-899, or you can also message us on the Viber line is, Doc?
0945-971-4011.
Back to more of today's best music.
Magic 89.9.
Today's Best Music Magic 89.9, Doc Rylan, my official co-host here on Healthline. Oh my goodness. And we're talking about Taylor Swift songs because I was being honest that I only appreciate. I think, oh my God, the Swifties are going to hate me, Doc. Your daughter's a Swiftie.
She is.
Okay.
She is. And she.
How old is your
felt
daughter again?
So bad that she wasn't able to watch a concert in Singapore because they ran out of tickets.
Oh my
couldn't get
gosh.
one.
I bet she was dolled up at, like, diba? I had a friend who watched her concert dolled up. Like, like a...
Everyone wanted
Right?
to doll up.
I think I'm going to, I think I might watch it just because I want to dress up. But that's...
Or want to see the others, like people watching.
Oh.
Look at how they're dressed up.
Right. It would have been fun. Doc, since you're the expert, trigger finger, let's talk about that. It's the first time I'm hearing this.
Seriously.
Apparently, Doc New has a trigger finger, yung middle finger pa daw, and uses a splint. Doc is an opto.
Okay.
Okay,
Well,
so hi also to Brian of Animal Scene. Hi, Brian.
Hi.
Okay. What is trigger finger?
Okay. Trigger finger is...
Why am I thinking of the middle finger?
Well, it happens in the middle finger, but it can happen any of the different fingers. Whether it's the thumb, your forefinger, or your pointy finger, or the
Is it
middle.
like a form of spasm or something?
No.
Okay.
Unfortunately, it involves the joint. It's not the bone per se, but the joint itself. Let's put it this way. The forearm is the muscle that moves our hand
This
and our
one,
fingers.
the forearm.
Yes,
For those of
exactly.
you on playback.tv/magic899.
Exactly.
What is this in Tagalog?
We use it as braso as well.
Braso,
but
okay, fine.
unfortunately, the arm is also braso. So
Okay.
we have to specify it. Anyway, so when that moves, when that contracts, our hands, our fingers do close open.
Yeah, like a baby close.
Exactly.
Open. Okay, and then...
Unfortunately, with trigger fingers, it's like close open and it doesn't open anymore.
Wait, is it painful if you force it?
is.
Oh my gosh.
It is. And sometimes it's the opposite. It's close open and oops, I might get the...
So parang the middle finger. Oh my goodness. Okay.
So, anyway, so the thing is, usually that joint, it's called an A1 pulley. So if you could just imagine, there's this muscle on the forearm that becomes a very, very thin tendon all the way to the tip of the finger.
Oh.
And then that passes underneath several pulleys to give us a very intricate finger movement. And unfortunately, the one on the palm, it's your A1 pulley, more often than not becomes inflamed for one reason or another. Overwork, too much work.
Does diet come in? A
No,
fat
diet
factor?
doesn't
No?
come
Okay,
in.
okay.
It's movement.
Okay,
So if it's
parang
inflamed-
overuse na ganun. Okay.
Either overuse or suddenly used.
Oh.
If it's in your dominant hand, like you're right-handed, it happens in your right, then the likelihood is overused. But if you're right-handed and it happens in the left hand, there's a possibility of forceful movement in that side.
Does that, is it sort of connected to a nerve?
No, actually
then.
not
Okay.
the nerve. It's the tendon.
Okay,
so what
tendon.
happens now is that there's like a inflamed area, so the fluidity of motion is no longer there. That's the reason why when you close open, it doesn't open anymore. So
Surgery?
no.
Okay,
no,
not yet. Okay.
Not yet. No, wait.
What's the remedy?
Simply because it is inflamed, so like any inflammation anywhere in the body, it needs several things. It needs to rest.
Okay.
It needs heat for relaxation in the area.
What about ice baby? No?
Not ice.
Okay,
Ice is
heat,
good for
okay.
acute inflammation, but usually for most of this time, it's like kind of a several days thing.
Okay.
So with all of that, hopefully that inflammation subsides so you now have a better movement, no more locking, no more pain. And if necessary, we sometimes give any anti-inflammatory.
Okay.
Question
so like
is-
over the counter, ganon.
Question is, unfortunately, if it becomes too chronic, that swelling and
That sounds
inflammation
painful.
becomes thickened out or hypertrophied.
What? What?
Hypertrophied, simply thickened out. So I said thickening out.
Oh, okay, thickening.
So-
okay, doon na tayo sa thickening out.
Oh, so here's the thing. You do have trigger finger I don't know if it's inflamed or thickened out. The only difference, because their symptoms are exactly the same. The only difference is if we do conservative things, if you get well soon, then that thing is just inflamed.
So where else is that? Also, trigger finger. Pwede ba naman trigger toes? Pwede ba nangyayari sa
Not
finger
so
lang?
much because the movement of our toes isn't as intricate as our fingers.
Okay. So what can you suggest for Doc New?
Doc, I do suggest you rest it out. Unfortunately,
Or see a good
I
ortho.
couldn't do this and that. No, but simply rest it out.
Okay.
Rest it out. Do warm compress, and I do suggest with the warm compress instead of just putting in a hot pack over the hand, the forearm is involved. So better in a basin of warm water. Just soak your hand all the way to the elbow. 20 minutes.
Okay.
Twice a day if you can.
I hope that helps, Doc. And I have requested for a picture of the trigger finger.
Exactly. And then afterwards, let's probably talk off air.
Diba? Now we're on the topic of icing it. I mean heat pads and
Yes.
for a sprained ankle,
Or
it's very
sprained
common. Or
yes.
anything sprained like a wrist.
That's where ice helps.
Okay, there you go.
There's a difference between ice and warmth.
We're
and the
listening.
heat.
We're listening.
Okay. So if something acute happens, something like, you have a sprain or you were suddenly hit and there's a contusion, ice is what's needed.
Pamamaga.
Yes.
Okay.
It's ice. Why ice? We need what we call vasoconstriction that comes from the cold of the ice.
Okay.
So with that, your blood vessels tend to kind of cramp up, close up, and there won't be much bleeding if there is a possibility that a blood vessel is involved. But we only use ice 15 minutes every 2 hours.
Yon. So there is an interval. Okay.
Yes.
So 15 minutes and
Every
then
2 hours.
2 hours.
Why? Notice if you hold ice. I mean, if you're trying to put in ice on your drinks and you hold ice for a couple of minutes, what happens? You notice that your palm would probably be as white as anything.
And pruny.
But notice if you hold that ice cube, bigla ka pala napakwento. Hawak-hawak mo si ice. Well, 30 minutes na, you forgot about it. And then try to release it. Notice what happens to that hand of yours. It's no longer white. It's very red. Because unfortunately, beyond
And then wala
20
nang
minutes,
pakiramdam.
beyond 20 minutes, you actually would have vasodilation.
Whoa, which is bad.
So that's why it's quite sensitive, and blood will actually ooze more than we want to keep it in place.
So guys, again, it's 15 minutes max and an
Every
interval
2
of 2 hours.
For 24 hours.
For 24 hours. Thank you, Doc. 6:54 here on The Magic. Second hour of Healthline. We have a gentleman who's going to talk about biohacking.
I wanna listen to that.
Parang ang naisip ko, Doc
Hacker.
Rylan. Oo, hacker na. Ano bang hack nito, diba? And of course, I'm just thrilled that my new co-host, Doc Rylan
You're
Flores,
listening to Tina
is
Ryan and Doc Rylan.
Woohoo! Again, if you have any questions, 863-10899, or you can text message us via Viber.
Messages, yes. It's 0945-971-4011.
Here we go with my future ex-husband number 2, Tommy Richmond.
Magic 89.9.
Doc Rylan here. You've listened to the entire album of
Listen to the entire album.
Jenny.
I have it in my car.
Oh my! It helps when you have a daughter, huh? So among the members of Blackpink, who do you like?
I like all of them.
Really?
They have different personalities and different likes. I mean, songs right now of Jenny are really, the variety is there. Of course, you have the beat and everything else from Lisa with the dances and all. You have the simplicity and beauty of Jisoo. And of course, you always have Apate from Rosé.
Rosé. Oh my goodness. There you go.
Told you I'm a blink.
He's not just a, how do you say that? He's not just a orthopedic surgeon and a DNA profiler. He loves music. Doc Rylan is my official co-host here on Healthline. Thank you so much for tuning in the past, our first hour, actually.
Exactly.
Bilis ng oras, Doc.
Fast.
Oh.
I know.
Coming up on our second hour is Mr. Chris Williams regarding biohacking. So please stick around. And thank you, Doc and Doc New and Pong for sending the picture of the trigger
I know.
finger.
We'll talk about it later off air.
Here we go, taking a short break.
Magic 89.9.
Today's best music, Magic 89.9. Akon with Never Really Mattered. Of course, that sounds familiar.
Definitely.
I Hi, OJ. Let me love you down. 90s kid. My partner here, Doc Rylan Flores, officially.
Yes, you're still with Healthline with Tina Ryan and Doc Rylan.
And this is our maiden episode. And how funny that our guest, this is, what a small world. You guys were supposed to meet.
Yep. We were just setting a schedule for a meeting because he just came back from Hong Kong.
Yep.
So.
Oh, my goodness.
I've been hunting him since I've been here for 6 months.
Oh, come on. We had several meetings already.
From RRG or Regenerative Research Group, we have Mr. Chris Williams to talk about biohacking. Hi, Chris.
Thanks,
Welcome
everyone.
back.
Yeah, happy to be back.
OMG. So you guys actually met before. This is awesome. This is going to be a good night.
Well, listen, Dr. Ryland, he's the top of his game. And so we only work with the very top guys.
Wow.
And,
my head's going to explode.
Yeah.
You gotta go see his. You gotta go see his big new beautiful clinic. I mean, it's a must stop.
I was just gonna say, don't forget the little people, Doc.
I was there for his.
Research group, right? It's the research because whatever you do, it has to be backed up by research, and that's what this guy's doing.
Yeah.
Okay.
Well, we like Dr. Riley because so many people are in pain, and that's what he does.
I'm in pain.
I know. We were talking about her.
Sorry,
I know. I know. She needs to do the combo.
Exactly.
Yeah.
Yeah.
Oh, combo. Oh, I like that combo.
Let's put your. I want to see your X-ray. I want to put it up. Let's see it. Let's show the fans.
Oh my gosh, that is embarrassing.
Is it?
I have a spine of a 95-year-old. But welcome back to Healthline. For those of you just tuned in, 863-10899, or you can send your questions via Viber 0945-971-4011. Also, playback.tv/magic899 if you want to see our cute faces. Diba? Okay, so before we get to Chris, we had two questions. One's from Mabel.
Okay, Mabel.
Ooh, where is it? Doc.
Mm-hmm.
Is there, Doc, oh my gosh, where is it?
It's just there.
Wait, oh my gosh. It's regarding tech neck.
Oh, yes, tech neck.
I feel like my phone is ruining my spine.
It is.
Jeez.
It's not really the spine. It's more of the muscular area that creates your posture that gives you a problem in the long run. Wow, so technical.
I know. No,
it's simply,
layman's term.
It's simply this. Most of us probably work with computers, right? So the question is, do you have a laptop or do you have a desktop? That's the first question.
Okay.
Why? Because if you do have a desktop, you have to have the area, your workspace, work for you and not you working for your workspace. What do I mean? If you do have a desktop, more often than not, I won't give you angles, nor would I give you distances or lengths. But the idea is you sit properly on your seat. I mean, your behind is literally on the corner of the seat.
Like a butt.
Exactly. And then your foot planted well and your arms in a comfortable position. Then you lift the monitor to your eye level.
So why is it becoming a habit?
Because anytime you look down, your eyes look down, your head tilts down. And if your head tilts down, you have that small muscle in your neck, the trapezius muscle, who will try to prevent that head of yours, which is around 2 kilos, from dropping to the table. So you could just imagine holding on to that. So you'll eventually have neck pains.
Okay, so there is a thing called tech neck then.
Yes.
Yeah, I mean, in the USA, offices hire special experts, and they go fit each person.
Exactly.
Because there's also the way you sit with your arms.
Exactly.
And they will design your entire workspace to avoid all of that. Like, it's big business.
Ergonomic.
That's right.
Ergonomically correct chairs.
Yeah.
And besides, I mentioned a while ago, what about if you do have a laptop? Because some, with the easiness of it, they can travel anywhere with a computer.
Yeah.
The problem is with the laptop, the monitor is connected to your keypad or keyboard. So what happens now? The thing is,
Parang ang hirap naman if
but the thing is this, because it's connected, the same thing. You sit down well and all, and you lift up that laptop at eye level. The problem is this, because the keyboard or keypad is connected, it's so difficult to reach for it. You'll get strains in your arms this time. So what you do, because that's your job, you go buy the portable Bluetooth keypads so that you can actually, use it in a comfortable position.
So really, posture is still a big factor.
Yes.
Well, it's a lineup. And what's scary about the Philippines is I think it has the highest Facebook participation rate in the world.
Oh my gosh.
And if you look at the younger generation on TikTok, and they say your head is like over 2 pounds, and so when you're tilting forward and looking down at your phone, you're putting 2 pounds of stress on your neck, which is not
It's
normal.
2 kilos, not just 2 pounds. 2
Is it 2
kilos.
kilos?
Yeah.
2 kilos.
So never in our history would you be looking down like this for 4 to 6 hours a day, putting on that strain, and so people develop a tail.
Why
right?
am I?
That bone.
Oh my gosh, it's protruding.
That tail is actually the first thoracic spine
sticks
vertebra
out.
Yeah.
near your spinous process that actually
It starts to stick a little bit.
That's
huh?
why you find it like a tail at the end.
Yeah.
Why am I reminded of this Jerry Maguire scene? Like, remember that little kid?
No.
Is it true, Jerry, that the
I need to go
human
rewatch
head
it.
weighs 8 pounds? Remember that kid?
That's why
on
it's 2
Jerry
kilos.
Maguire? Right?
In fact,
And here's a problem. There's this muscle. It's called erectors. If you do your grocery, that's simply lomo.
Okay.
I mean, that's the entire, the entire back muscle that makes us straight.
yeah.
So if there is a problem in the neck, and that fasciculation and that strain can simply just go down all the way to the lower back. So you now have not just neck pain, you also have low back pain.
Okay, so I have an. Okay, go ahead, Chris.
Well, I was going to tell you, I worked with a chiropractor, and he gave me some exercises to fix that because I was having pain from it. I wanted to see. You guys need to be watching the video. I'm going to show you one, and I want you to tell me if this is right. They call it the chicken neck, and they say you're supposed to do these.
Okay,
There's an
guys, for those of
exercise.
you
Do
on
know that one? Have you
playback,
seen that one? I don't know if I'm doing it right, but it's called like the chicken neck. Because
so it's like bopping your head forward.
Yeah. It's not an up and down. It's a front and back movement.
Front and back movement.
Yeah,
and
that's
it'll
a
be
very
done
powerful
best
exercise.
with good music.
Yeah, there you go.
There's a song with a video where they were doing that.
Yeah.
I'm going to look for that song.
But I'm serious.
and
Like, if you
sing
have
it to you.
kids with like neck pain and people talk about that, I think that's a great exercise. And another one I heard is that you look and use your peripheral to strengthen the neck or something. You know that
Wait,
one?
so-
I forget
You follow
that
it.
one. Yeah.
Okay.
Technically,
It's like
these
2
are-
really good
there are
exercises to
a lot
counter it.
of, all of these exercises you can do. As a matter of fact, just go to YouTube. There are a lot of exercises, but sometimes I do need to advise that if they're
everything-
not sure,
yeah.
if they're not sure, to consult a
Yes.
professional physiatrist, physical therapist, just to
Yes.
guide them on the proper movement.
Okay, well, there's another question regarding pain before we get to biohacking, and I'm
Sure.
sure you have inputs there as well. Mark, who's been parked on EDSA for 40 minutes.
Yeah, me
Oh,
too.
wow.
I was
Oh
just
my
there, so
gosh.
I was with
I
your
know,
brother.
I know. Just keep your cool.
Hi, Doc. How come I only feel pain after a workout and not during? Is it that normal, or am I just numb to life now?
Oh, no.
Thank
You're
you,
not
Mark.
known to that.
Sitting all day in the car.
I know, right? But here's the thing. When you do activities and your head is in the game and you're too concentrated on it, adrenaline is pumping. So you actually are able to do anything and everything that you want to do during workout.
Okay.
Unfortunately, when that drops, like fight or flight, when it drops, you now will feel an inflammatory reaction. I mean, there is inflammation.
The whole
happening.
body's inflamed again.
Exactly. But there's good inflammation, there's bad inflammation. So working out, you actually get good inflammation. So the thing is, after that workout, you hit the showers and then you recover, you rest well.
When you're actually exercising, there's micro tears in the muscle, and that is an inflammatory response. And so you're not going to feel it during, but
Afterwards. That's the
Right,
reason why
yes.
you actually bulk up. When you do bulk up, these are muscles that literally are tearing so that they can accommodate that strength, that size in the long run.
Okay. So, Chris, welcome back.
Yes.
Okay. So, let's talk about biohacking.
Yes. So while I've got Dr. Ryan, I want to bring it. Let's go right to what we're doing together.
Go
okay?
ahead.
Let's
Start it out. I'll be just here.
So, should I leave the room now?
Yeah. Well, I think like for our listeners tonight, it's like biohacking is really like the self-guided effort towards an optimal life, right? It's like it's do-it-yourself biology, right? So it goes against like, people are now using AI, and like you just said, go look up on YouTube. People are self-diagnosing, and biohacking is like, what can I do on my own to optimize my life? And one of my business partners had this great line, because people are now having access to a lot of diagnostic tools, right? We have access to MRIs, DEXA scans, blood panels.
Is that a good thing?
It's super good because so we're so used to being sold snake oil. Like so many people have been burned, right? They're like, oh, take this pill, take this thing, right? But now we have data and we can see it,
to
right?
back it up,
right?
okay.
Like you go down to Dr. Ryland's lab, he can scan you, he can see it. There is no guesswork anymore. It's not like, oh, I'm gonna take a guess. So we have all
no
these
gray area anymore.
there's still, it's less, but we have all these really powerful diagnostic tools. And so what's happening is people are getting blood panels. They're seeing their hormone levels. They're wearing sleep tracking data, right? They're doing all these things to get all this data, but they still struggle to really know what to do.
Okay.
And so, and look, he's got one right
that
here.
one.
Yeah.
Does it work though? Does it really?
No,
yeah.
it tracks things. It's like your
Step
regular
counters
pedometer, except that it does more than that. It looks at your heart rate, your sleep pattern sometimes.
Yep, deep sleep.
So
yeah. How many times
these
you
are all
wake up?
data that you can actually make full use of, well, provided that you can actually understand these data.
How many times he flips someone off when he's mad? It shows the anger data.
No, that's not
The
included.
trigger.
That's
We were
not
just
included.
talking about trigger finger.
Yeah.
Hi to JP and Joe Boy. Hi. Okay, so going back to the data.
Yeah.
Okay.
So we have all this data, and the question you need to ask yourself is, and my friend said this so well. He said, "Do you want to be at the low end of normal or at the high end of optimal?" And so what's happening in the clinical sense
The
is
latter, of course.
you say that, but when you go to a normal hospital setting, they basically will tell you, "Okay, you're okay. You're not going to die." Right? Like that's the job of the hospital is like to assess.
As long as you're within the normal limit, you're good.
That's what they say.
Okay.
But what people are finding out is I don't want to be at the low end of normal. I don't want my testosterone levels to be at the low end of normal. I don't want my sleep to be at the
That's
low
the
end of
reason why-
normal.
Optimal.
That's
Right.
the reason why some of the clinicians actually, when they do come and visit, they won't bring their lab workup anymore. And all they tell you is, Doc, everything's normal. Yes, because they're within the range.
That's right.
But we really do look into it because we look at where you are at that range.
And then you elevate that.
Because if there's, like Chris was saying, if you're in the lower limit, well, we might just consider you as being low of it. So we can prevent complications coming from whatever that workup would be.
Yeah, and I'll say one of the ones that's probably most shocking is they looked at like our grandparents' hormone levels. Like if you go look at your grandfather's testosterone levels versus what our men's testosterone,
yeah.
they're half what your grandparents were. Right, so like that's a big one. Is
Then what factors come in?
microplastics,
Oh, that's right.
pesticides,
Yes.
pollution, the
There are a whole
diet
lot
we
of
have.
things that are
So
different
many things are
this
attacking you.
era.
Yeah.
There's so many things different from this era than previously. I mean, like even a century ago would probably be totally different.
Yeah.
So you have all of these
Yeah.
things, toxins and everything else that comes
Bad
into play.
food dyes. So it's like, so you just take that one. So that's one thing I just said, hormones. But there are probably 100 plus factors you're
Factors,
looking
yeah.
A
at.
whole lot.
Like so while we have Dr. Ryland here, like I wanted to bring this up with you. What have you seen in terms of like bone density, bone health? Like let's talk about like postmenopausal women because that's usually
Exactly.
the easiest one. What
That's
are you
the
seeing in
easiest.
terms of like bone health? Like what?
The thing right now is when we talk about women and bone health and bone density, menopause comes into play. I'm not looking at you.
yeah,
No, I was just going to say I dated a bonehead.
there you go.
But the thing is, it's that we do expect what we call osteopenia, which is a lower level of density for women around this age.
And it's different.
But the thing is, what we're seeing more of is women who still are having their menstrual cycle, a little younger than the menopausal age, having osteopenic levels already.
Yeah, that's shocking.
So
So-
the
so-
factors you're saying play a...
Affect-
Okay.
There's a lot of them, but like so bone health, like that's what I'm saying. That's a biohacking thing. So we look at like postmenopausal women; they lose 1 to 2% of bone density per year.
No way.
So
And it starts at 30 years old. It
No,
doesn't
that's what we say,
start
it starts
at
even
when
earlier.
you're like
50
when you're like 50 or
okay.
on. It
At
starts
30.
at 30
so,
years old.
so if you have someone in your life, or you're a woman aging, or someone in your life's a woman, you look at that and say, what kind of quality of life do you have? Do you want to be able to move and pick things up? And how do you counteract that? Resistance training, diet, protein. So biohacking is like looking at each one of these little areas of interest and looking how to optimize and what to do. And so there's interventions, standard stuff, food and diet. But now we have all these fancy machines. We have electrotherapies, frequency healings, light healing, water healing, oxygen healing,
A
right?
whole lot of options.
So many cool technologies. And that, so the biohacking field is massive. And so, when you have Dr. Ryland, who's at the cutting edge of this,
What?
I'm saying they're
I'm in good hands.
I'm saying they're now looking even into biohacking. Like I was talking
Exactly.
about, are they going to get hyperbaric? You're going to get red light therapy. You're going to get these things to recover quicker
we're
and
no
stuff.
longer looking into the traditional ways, but we look into advances in science and put it into good use.
Yeah.
Wow.
So one of the things we're doing with Doc Ryland, just to keep the ratchet up the pressure here,
Hold on.
okay, let's
Yeah.
ratchet it up, okay, is now we ask the question with biohacking, how do I speed it up, right? Everyone is so impatient. Like, if I go tell someone, I need you to go to the gym an hour a day for 6 days a week, they're like, damn, is there not an easier way? And biohacking says there is an easier way.
Okay, but before you
I was gonna connect to that, but go ahead, Tina.
but before you go any further, in the most simple term, the simplest term possible, how would you define biohacking?
It is do-it-yourself biology.
Wow.
Well, it does need a little knowledge of who you are,
it
what
needs
you
a ton
are,
of
and what
knowledge.
you're made of.
Oh, it needs
and
a
that's
lot.
where
It needs a
RG
lot.
comes in.
Well, so our company does cellular therapies.
Yeah.
So just a little background on this, and then I want to go back
ahead.
to this thing. So is it okay if I give a little quick
Yeah,
background?
of course,
Yeah.
but let's keep that hanging. I got to take a quick
Okay,
break,
okay,
and we're
okay.
going to talk about the background of the
Okay,
company.
come join us on the video, everybody.
Yes. Actually, I'm gonna play something from the latest from Jessie J. So yeah.
Do your chicken next while you're listening.
Oh, thank you, thank you. Here we go. For those of you just tuned in, this is Healthline here on today's Best Music.
Magic 89.9.